Good evening and welcome to tonight's telephone town hall hosted by the Jefferson County Board of Commissioners. I'm Roger, your moderator for tonight's discussion with Commissioners Andy Kerr and Lesley Dahlkemper, along with County Manager Joe Kerby and several other subject matter experts. We are simulcasting tonight's event in Spanish, so I'm going to pause and ask county staff to make a quick announcement.
Saludos. Si desean participar en español, por favor oprima el asterisco y luego 0.
Our topics for this evening include results from the Community Health Assessment and Community Health Improvement Plan, plus the resources from Jefferson County Public Health, and a look at public safety programs with Jefferson County Sheriff Reggie Marinelli. We want to invite you to submit questions you might have for county leadership as well. Although tonight's discussion will focus mainly on those three topics, feel free to ask about any county issues that are important to you. If you have a question, press *3 on your phone. An operator will take down some basic information and you'll be transferred back to the town hall to listen until you're called upon. When I call your name, please repeat your question for the live audience. So press *3 to ask your question, and it's okay if you just listen along tonight. Again, I'm going to ask county staff to remind folks one more time how to transfer to our Spanish simulcast if you prefer to participate in Spanish.
Saludos. Si desean participar en español, por favor oprima el asterisco y luego 0.
All right, thank you. Before I send this call over to Commissioner Dahlkemper to kick off tonight's discussion, we want to survey those listening on several county-related subjects. To participate, all you need to do is use your telephone keypad to register a response. So here is survey question number 1. In general, how would you describe the quality of life in Jefferson County? Press 1 for very good, press 2 for good, press 3 for bad, and press 4 for very bad. Please record your vote now by pressing 1, 2, 3, or 4 on your phone, and we'll have a few more questions throughout the town hall, so please stick around to make sure your voice is heard. So with that, let's turn it over to Commissioner Dahlkemper. Good evening, Commissioner.
Roger, thanks so much, and thanks to everyone who's joining us. I'm Jefferson County Commissioner Lesley Dahlkemper, and I represent District 3, or South Jeffco. South Jeffco includes Littleton, Morrison, Conifer, Evergreen, and portions of Lakewood. Dr. Sarah Story, the new Jefferson County Public Health Executive Director, will join us in just a moment. Jeffco Public Health is committed to promoting and protecting health for all people across their lifespan through prevention, education, and partnerships. And currently, Jefferson County Public Health is in the process of developing its 2023 Jefferson County Community Health Improvement Plan. The Community Health Improvement Plan, or CHIP, is a responsive approach to the needs of Jeffco and serves as a starting point in informing and guiding collaborative health improvement efforts, goals, and priorities for work at Jefferson County Public Health. And just a quick reminder for our audience, if you have a question, press *3 now on your phone. Dr. Story, thanks so much for joining us. It's great to see you.
Thank you so much. First of all, I want to thank you and the other commissioners, the county manager, and everyone who's made my transition here so welcoming. I was really drawn to Jefferson County because of the guiding principles of the organization are really about respect for others, even when we don't agree, collaboration, trust, innovation, and I think it's important to stress how much our department is driven by health equity. And that really means that we design our plans and our programs to ensure everyone in the county has an equal chance to live a long, healthy life, no matter what part of the county they live in. So some people aren't very familiar with public health, but I can just sum it up in saying it's all about getting ahead of things before they become a bigger problem. And that's what we call population health. It's very different than going to the doctor and getting standard medical care. So you mentioned the County Health Improvement Plan. We call it the CHIP for short. so that's what I'm going to refer to it as. As a public health department, we are required by our state government to do this every few years, but even if we weren't required, we would still do it because we care so much about the CHIP. And it's worth really reminding everyone, the CHIP is not the health department's plan. We steward it. It's the county's plan, and it's our plan to make sure we're considering multiple points of view and all of the strong evidence around what will make us healthier. So we as the health department, we lead this process for really narrowing down our priorities and tracking progress and evaluating what works, and we stay accountable to both you as commissioners and the Board of Health as well. But we all have a part to play. So we worked very closely. Our team worked with community-based organizations and community members really to gather perspectives from people who live in, work in, and visit Jefferson County. We also have a ton of data. So all of the priority areas that we're coming up with are really addressing the most pressing needs. Our community health assessment, which is just basically, imagine it's like the data dictionary of everything we know about health in Jeffco, is also available in Spanish. And you'll be happy to know it's the first time any local Colorado public health agency published this in another language. So that's really a big win for us in Jeffco. It's very thorough analysis, and it's not just about what's hurting us, but also what makes our county special. And it's really important to me that we take a strengths-based approach. So let's find out what makes us resilient, what resources we have. We ask people, what keeps you up at night? What are you worried about? But also what you're very proud of about Jeffco. So all of that is really what feeds into the County Health Improvement Plan.
Great. Thank you so much, Dr. Story. And as you know so well, we work very hard to be inclusive here in Jefferson County, and it's exciting to hear from you that we're leading the way in terms of ensuring that the Community Health Needs Assessment is also available in Spanish for our community members. I'd love to dig into more about what you're learning from the assessment. What does the Community Health Assessment tell us about strengths and concerns regarding the health of our community in Jeffco?
Yeah, it'll probably come as no surprise when I tell you this list, because these are the things that everybody here think about. We're driven to improve. Climate change, air quality, those are very big, and that really does kind of set us apart in Jeffco as a major concern for folks. Disease prevention and control. So when I say that, people are still very concerned about infections and communicable diseases, that's still very top of mind for people. But then we get into some things that traditionally folks might not realize is public health, and those are things like economic stability. How am I going to, pay the bills at the end of the month? These are the real issues that I'm sure you hear about all the time that are really keeping people up at night. Access to healthcare that works for them, actually like culturally appropriate healthcare is a really, really big issue. Food security, which is obviously connected with economic stability and housing. And then mental health, and especially mental health for groups who may not be able to access traditional care or feel comfortable doing so. LGBTQ plus health. And health of the unhoused, suicide prevention, and then of course substance use and substance use treatment. Those are the biggest issues. That was a lot, but those are the biggest issues. Yeah.
Yeah, a lot of issues, indeed, and certainly issues I think that align with what we hear from our constituents. Commissioner Kraft-Tharp and Commissioner Kerr and me, as we talk with community members as well. Thank you for walking us through that. Mm-hmm. How, as we step back and look at some of the challenges and issues that we're working through, opportunities ahead for Jefferson County, how do the findings you just shared with us compare with other counties?
Yeah, in many ways, Jeffco has a lot of strengths comparatively, if we look at our peers. So we have fewer preventable deaths, and we have longer lifespans than a lot of our peer counties, and we should be very proud of that. But we have very unique challenges, too. So one I mentioned before, because of our natural environment, and it's one of the things that drew me here, I thought, what an amazing challenge when we think about the effects of climate hazards we feel it very acutely here. And it's not just a long-term generational climate change issue. This is today. Wildfires, right? Wildfire risk, and how much money do I have to pay to insure? And we look at flood hazards. And a lot of our neighbors are very concerned about that. We also have, and this will maybe surprise some folks, but we have higher rates of suicide, alcohol-related deaths, and drug-related deaths than our peer counties. And that's just not regionally, but actually nationally. If you look at counties with similar demographic profiles to Jefferson County, we are performing at a rate that I would not have expected to see. When you dig into the county and kind of break it apart into smaller areas, we see some areas in Jefferson County with higher rates of alcohol-related deaths and drug-related deaths than in Denver, than the city of Denver, which you might not, if you're looking at the county as a whole, those differences might not pop up, and we wouldn't know where to intervene. And that's really what public health is here to do, is to take that data and make sure we're driving resources to the right place. And that's a big reason we are focusing on those issues in the next couple years as we develop this plan, and really designing new ways to tailor the solutions in partnership with individual communities instead of a county-wide blanket approach.
Great, thank you so much. And for those of you who are tuning in tonight, a friendly reminder, if you have a question, press *3 now on your phone. Again, press *3 on your phone if you have a question for Dr. Story or anyone who is here tonight at the county building. I'm wondering if, Dr. Story, there were any surprises for you and the public health team in the findings. And I suspect our listeners may also be interested in knowing in what ways will the health assessment's findings influence priorities moving forward. As you pointed out, there are a lot of issues that you're working on.
Yeah, they're really big issues. I mean, these are huge issues, and some of these are easier to work on regionally or at the state level. And so we always have to balance, the gravity of the issue with whether we can even do anything about it at the local level. And we need to be very prudent with the resources that we have, because they aren't unlimited, that we're focusing on issues we can actually see some change in our lifetime. So from my vantage point and the research I've done and early analysis, economic issues related to food and housing and mental health, including substance use disorder and treatment and suicide prevention, are the top priorities. They're priorities that we can affect at the local level. We already are. There's already a ton of good work happening. And now it's really about making a plan that has action attached, and not a plan that says, oh, we're going to make another plan, or we're going to have more meetings, or, this is really going to be action oriented, and that makes me very excited. We will be updating the Board of Health every month. And we encourage all of you to join us at those meetings. They are public meetings, and we do love public comment, so we would love to see people there.
Excellent. Thank you. So lots of ways for community members to engage and to get involved and make sure their questions are answered. And speaking of your questions, if you have a question, press *3 now on your phone. Again, press *3 for any questions that you might have for Dr. Story. We'll have Sheriff Marinelli joining us in just a moment. As those questions are starting to come in, Dr. Story, I'd love to talk with you more about the opioid epidemic. This is an issue we've been working on very hard in our community, but also in our region. Jefferson County partners with Gilpin County and Clear Creek County to tackle substance use disorders. We're looking at settlement dollars from the opioid litigation to help us address everything from treatment to boosting our mental health co-responders, an issue I know Sheriff Marinelli has been working really hard on, housing, recovery community organizations, and more. Tell us a little bit more about Jeffco Public Health's work in this area.
Yeah, I'm happy to share with you, what I know. Really, public health philosophy is we are uniquely positioned to move upstream. So there are preventative measures we can take to reduce the likelihood of dependence on opioids and other substance use disorders. public health is very, very focused on youth. And so one of the things I'm most excited about coming next year is the formation of a youth council to actually have youth-centered solutions that are inspired by youth and aren't just adults coming in and saying, this is what youth need to hear. I think it's really important to engage youth early. We also have a very vibrant harm reduction strategy. Very talented individuals who live with lived experience in that field, who are working to contact substance use disorder folks, and then really reduce the likelihood of overdose and death. So you kind of look at it on both ends of that spectrum. We're looking to ensure that substance users don't overdose, but we're also looking to the youth and early upstream interventions in mental health to ensure we don't end up in a place where we have more people addicted.
Great. Thank you so much.
Thank you.
A reminder, if you have a question, please press *3 now on your phone. And I see we've got a couple of questions coming up. And we're also more than happy to take questions that may not be specific to the topic we're discussing, but are relevant to the work that we do across Jefferson County. So I see we've got a question from Jens, I believe it is.
All right, let's go to Jens first. Jens, go ahead.
Yeah, I know that this county has a crazy amount of parks. And I was wondering what kind of opportunity for construction or kids, or what could we do with these parks to make money and not damage the entirety of them?
Great. So this is Commissioner Andy Kerr. Thanks so much for your question. Yeah, Jefferson County really is blessed with many open space parks, and also some of our municipalities, Lakewood, Golden, Arvada, also have a high number and percentage of parks as well. For Jefferson County, this actually started in 1972, where the residents of Jefferson County passed a ballot measure that there would be a 0.1% of 1% sales tax collected specifically for open space. And this was one of the very first times anywhere in the country that the taxpayers had voted on a sales tax like this, specifically for open space. And so the county, in our particular geography, from the Sheridan corridor, really being fairly urban, all the way up into the foothills, where we have a lot of opportunity for open space. The mission of open space very much is focused on conservation, but also being open to recreational opportunities. So for people hiking and biking, people who want to go fishing, all of these things are wonderful recreational opportunities here in Jefferson County. One of the things that open space and the county in general have been focused on is transportation and making sure that there is access to trailheads, and not just from people getting in their cars and driving, but also making sure that there's public transportation available, and also people taking Ubers and Lyfts to our trailheads, and making sure that it's accessible for everyone in Jefferson County. We get quite a few people from the metro area outside of Jefferson County or from our municipalities who also take part in the recreational opportunities and enjoying the open space that we have here in Jefferson County. And our open space folks are often on a year-to-year basis are nationally recognized by their peers as having one of the best open space programs in the entire country. So with that, I know you had some other points in there too, but we are very proud of our open space program, and definitely one of the jewels of Jefferson County.
All right, thank you, Commissioner. Let's hear from Roy next. Go ahead, Roy.
So my question is, would the county consider doing something about all of the open burning that's going on year after year, season after season, all year long in Jefferson County? A lot of people think they're saving money by burning wood, and yet the particulates in the air, the fumes from the burning are all creating a health hazard. In the area where I live, any given day, you can come through here and smell the burning, smell the smoke. I have neighbors that have confessed to me that they burn their trash in their chimney places. I have another neighbor who burns his slash, his leaves every year in an open pit in his backyard. I have another neighbor down the street who's got an open fire pit in his front yard and burns all year long, summer, winter, fall, spring. And, living in my house was built in the 60s, and I don't have air conditioning, so I depend on the cool evenings to get some relief from the summer heat. And I have to close up my windows because people are burning stuff all year long. So,
Roy, I think Sheriff, we've got the sheriff that's going to address this.
Okay.
Hi, Roy. This is Sheriff Marinelli. Just when there's a complaint on wood burning in the county, obviously you can always call the Sheriff's Department, but the county has set some standards that all new wood burning stoves and fireplaces that are installed in the county must meet stringent EPA, Environmental Protection Agency, emission standards. During high pollution days, which are action days, no wood burning is allowed below 7,000 feet elevation, except by using EPA Phase 3 stoves, which are approved, such as pellet stoves or masonry heaters. So on action days, for the air pollutants generally indicate that air quality will be in either the unhealthy or unhealthy for sensitive groups categories, according to the Air Quality Index. During an action day, open burning and wood burning may be prohibited until the air quality conditions improve. Now, I know a lot of this is extensive to try to figure out if it is a day where you can burn or you can't burn. And so the county has set up a way to do complaints. Again, I will reiterate that you can always call the Sheriff's Department and we'll check in to make sure that it's a legal burn. But your complaints about wood burning during high pollution days should be directed to your city officials, usually the zoning department. And if you live in unincorporated areas of Jefferson County, we ask that you call the planning and zoning department, and I can give you that phone number so that you can have it on hand. That number is 303-271-8700. Thank you for that question.
Thank you, Sheriff. Let's hear from Kathy next.
Hi. I've had a couple quick questions. One, I was just listening to a discussion by the CDC today, and, for example, masks help decrease things like flu, not just COVID, but a variety, and just generally getting sick. But have you come up with good ways to depoliticize public health? Because that's part of the problem. I would be interested I produced a public health commercial about 8 years ago trying to get health care out of the political realm, just to get people to use common sense. Don't jump in front of trucks because you probably get hurt, regardless of how you think of life. But so have you come up with ways to depoliticize that and just to reach out to the public? Like, for example, a mask helps decrease flu rates and all those other things that are dangerous, particularly for people at risk, like seniors and that type. That's one. And then two, I'm very much interested in your youth program. I've designed lots of programs for 22 schools, 6 school districts, and I find that if you do get kids to have proactive, positive things to do, they're less likely to get involved with negative things. If you can get free flying lessons, that's more fun than sitting at your house, getting drunk or doing drugs. So I'd like to get the contact for your youth program. But then also, have you come up with any good ways of reaching out to the public in a way that reaches all the public, so that, make, like wearing a mask, hey, it's cool, or something?
Kathy, this is Dr. Story, and I really do want to see your commercial. So I definitely want to see this public health commercial that you made. You've got me very intrigued. I'll answer regarding the youth mobilization that we're working on. So we're in the early stages of developing something really focused on substance use prevention and also on nicotine dependence in youth. And so stay tuned for that. But in the meantime, we work with Jeffco CTC, and that their website is jeffcoctc.care, and they're a major partner for us, and they do a ton of youth groups and mobilization. And if you reach out to them on their website and just share a little bit about your story, I guarantee they're going to be really excited to meet with you. Regarding the I can't even say that word, Kathy, and you said it multiple times, and you were so good at it. Public health being political. So, I've been in this role 2 months now. And so I wasn't here during the pandemic. And, I'm coming at it with kind of a fresh perspective. And I really do think, and maybe this is a little bit overly optimistic, that all of us in this county have more in common than we have different. I will say that there are tools for reaching people that I'm really excited to pursue when it comes to kind of public campaigns and not kind of doing a one-size-fits-all. So I'll give you an example of new ways that public health are really trying to reach people where they're at. If you go onto your social media and you see an ad for something that you happen to talk about, a couple days ago with your coworker, and you're kind of freaked out because all of a sudden you have these ads, there's very powerful algorithms around how we can actually get information to people where they're at. And I really do believe that's like an untapped resource in public health, is thinking through smarter ways of doing campaigns versus what you might be used to seeing, which is something like a poster in a bus stop, right? But how do we get onto TikTok, for lack of a better option? How do we get into where people already are? But I also think there's really a ground game to this, Kathy, and it's really about just building relationships. And so I'm very committed as a new director to making sure that I'm present in places where we might not have a relationship. So making sure I'm in our mountain communities, make sure I'm connecting with chambers of commerce and business sector in those spaces. And so I'm with you. It is a puzzle that we're all really working on, because we're all really recovering from a time that was very divisive and very traumatic for a lot of people who went through that. So I love that you love masks. I know not everybody does. And right now, our point of view on that is that, it's recommended if you're working with vulnerable populations, especially if you're not immunized against flu or you haven't been COVID boosted. But that's as far as we go with that for now. So I really appreciate your love of public health. It's very obvious from your question. And it's really great to hear your perspective. So thank you on that.
Well, thanks again for all the great questions and feedback, and a huge thank you to Jefferson County Public Health Executive Director, Dr. Sarah Story, for providing insight into how these issues impact every one of us. Before we dive deeper into our next topic, it's time for another survey question, and for that, I'll turn it back to Roger.
All right, thank you, Commissioner. Again, to participate, use your telephone keypad to register a response. Here's our second question. Do you think the quality of life in Jefferson County is likely to improve, stay about the same, or decline during the next 5 years? Press 1 for improve, press 2 for stay about the same, and press 3 for decline. Record your vote now, and we'll go have one more question towards the end of tonight's discussion. So please hang on. Now, Commissioner Dahlkemper, let's go back to you for the next segment.
Great. Thanks so much, Roger. And before we jump into the next segment, I'll just do a quick reminder to please press *3 if you have any questions at all. I asked Dr. Story to share some additional details about the 2023 Community Health Assessment results and next steps. And in this section of the Town Hall, we'd like to highlight some of the work our public health team has done over the past months to deliver services for Jeffco residents. Thanks again for joining us, Dr. Story.
Thank you. Wow, I'm really getting a lot of airtime tonight, so this is great. So community health assessment, it's probably no surprise. We saw a lot of persistent effects of the pandemic, not just on our physical health, but our connection with other people. And this kind of speaks to Kathy's question earlier. There was a lot of isolation. A lot of us experienced that, and it was very real and had a very negative impact on our community members. And we're really thinking about that as we plan for future emergencies and think through ways to kind of heal those divides. So emergency preparedness is a really big part of public health, and many people don't even realize that. When we asked the community to define health, they didn't just say it's not having a disease. They would say it's safety, it's security, and it's friendships, and it's peace, and that those things really matter more than anything else. And the community members we talk to understand that. So I will say that many respondents are very pleased with the quality of life here, even if there are very, very real challenges.
Great. Thanks so much, Dr. Story. We're watching the time. We're halfway through our town hall, and we so appreciate your response on that. Roger, we were looking at the time and kind of where we're at in the script, and we know we also want to get to more questions from our listeners, and we also want to hear from Sheriff Marinelli. I'd love to turn it over to you and to Commissioner Kerr next. And it looks like we might have another survey question, if I'm not mistaken.
We do, indeed. Let me pull that up. Thank you, Commissioner. Here's our third survey question. And again, just use your telephone keypad to enter the number of your response. And here is that question. Sorry, we're running on the fly here. How would you rate your sense of personal safety in Jefferson County? Press 1 for very safe. Press 2 for somewhat safe. Press 3 for neither safe nor unsafe. Press 4 for somewhat unsafe. And press 5 for very unsafe. Again, 1 through 5, register your vote. And we're going to turn the call over to Commissioner Andy Kerr, I think, to introduce our next topic.
Great, thanks, Roger. And again, I'm Commissioner Andy Kerr. I represent District 2, which is the central part of Jefferson County, including Wheat Ridge and Edgewater, parts of Lakewood Golden, and some of the central foothills as well. So I am, for this segment of our telephone town hall, we have Jefferson County Sheriff Reggie Marinelli, and we'll be discussing public safety and how the Sheriff's Office is currently working with our county and goals moving into the future. So thank you for joining us, Sheriff Marinelli. And right before we have Sheriff Marinelli, I just remind folks, if you would like to ask a question, please just hit *3 on your phones. And now, thank you for joining us, Sheriff Marinelli.
Thank you so much, Commissioner Kerr, and good evening, everyone. Just a few things that we've been up to at the Sheriff's Department. Last month, I joined the Commissioners and District Attorney Alexis King to recognize October as Domestic Violence Awareness Month with an official proclamation. The recognition provided an opportunity to learn more about preventing domestic violence and show support for the organizations and individuals who provide critical advocacy, service, and assistance to our victims. Also, on October 4th, Jeffco deputies welcomed local communities to join them for coffee and conversation at 3 locations throughout the county. If you watch our social media, you'll see that we do this at least quarterly, and the citizens can come out to those locations and meet with our command staff, with our deputies, and get to know them and ask questions. I was able to, on October 4th, to go to 2 of the 3 locations and met many of the community members there. Last week, we held our annual Safety and Faith Workshop, where local faith leadership administrators, safety team members, and staff, as well as interested community members, were invited to learn about risks and liabilities for our houses of worship. Now let's get into some specific topics of public safety. First, we are still very much involved with the DEA drug takeback, which usually occurs twice a year, once in the spring and again in the fall. Unfortunately, both days this year it snowed, so we may not have had as much participation from our citizens due to the weather, but we will remain very involved in this effort to get these drugs that are no longer being used out of the households and disposed of properly so they cannot be misused. I do want to mention that the Sheriff's Office also has drug drop-off boxes in all of our locations that you can use all year long to drop unwanted medications off. Also, we will continue to participate in the Shred-a-thon efforts, where citizens can bring their documents to our main parking lot and have them shredded. This is such a great program to make sure these documents do not end up in the trash and that important information cannot be obtained by those wanting to steal someone's identity by using such things as a date of birth or social security number that they obtained from thrown away documents. These efforts are valuable to keep our citizens safe. So let's talk a little bit about what we call focus crimes. These are burglary, theft from a motor vehicle, and theft of an actual vehicle. These crimes have been highlighted in recent years, especially the theft of a motor vehicle. Colorado was number one in the country when it came to stolen vehicles. And actually, not even Colorado, the Denver metro area was listed as number one in the country. I want to assure the citizens that we have been working very diligently all year on this particular trend, and I am very proud to announce that all three of these crimes, burglary, theft from a motor vehicle, and motor vehicle theft, in the third quarter this year was the lowest number we have seen out of the last 5 years. So our efforts are paying off. I do wish to remind our citizens how important it is to not leave items in your vehicles, lock them at all times, and make that an ongoing habit. Then make sure you close garage doors. We don't want to give bad guys the opportunity, so securing your property, your vehicles, and closing your garage doors will deter anyone from making you a victim. We have a trend right now that we are noticing that we began to discuss this week at the Sheriff's Office, and that trend is that there are several thefts happening right now within our gyms. People like to work out, and unfortunately, the bad guys know that, and so they will prey on people that go to work out. They work out and use the lockers inside the locker rooms, or at times they set their personal property aside within the gym, and they occasionally take their eye off that property. And this is where people see opportunity, and when opportunity presents itself, people are going to act on that. So we're also seeing a lot more items being taken from the vehicles parked outside of workout locations. So make sure if you have something valuable, leave it at home. Do not bring it to the gym. And again, lock your vehicles and do not leave anything of value, such as a purse or a wallet, in plain view inside the vehicle. This is what thieves are looking for. So if you give them the bait and the opportunity, they will strike. So take that opportunity away from them. So in closing, we have wrapped up another successful year of our Citizens Academy program. And for those of you who aren't familiar with this program, it is designed to provide Jefferson County residents firsthand information about how their sheriff's office works in an interactive classroom setting, and our Citizen Academy runs 10 weeks. So if you're interested in that program, please get a hold of my office, and we will get you into that program and let you see what we do from the inside of our walls.
Great. Thank you so much for all that information, Sheriff Marinelli. And just a reminder, if you have a question for your commissioners or any of our guests this evening, press *3 on your phone. So now let's take a little time to address some of the questions and concerns from the Jeffco community. So Roger, who do we have up next?
All right, let's start with Sandra. Sandra, go ahead with your question.
Yes, with fentanyl running rampant across Colorado now, I'm just wondering what we're doing to protect the general public, not the users or the law enforcement, but the general public. Is there education programs? Is there safety measures being taken at the post office? is Narcan going to be readily available to just all of us everyday people for emergency use, in case we're exposed accidentally or maliciously? What if somebody drops powder on open produce at the grocery store or rubs powder on a public doorknob or something like that? How, can we have Narcan at our ready available to treat ourselves in the case of some accident or unpredicted exposure like that?
Sandra, this is Sheriff Marinelli again, and I'll go ahead and kick this off. I think there's more than just myself in this room that can actually answer portions of your question. For right now, as far as law enforcement, we are doing as much education as we can. We have our school resource officers that are in every one of our schools that are talking to the kids on a daily basis, trying to get them to understand the dangers of fentanyl and how to stay away from it. Outside of our schools, I can tell you right now that I am fully aware that our county coroner, Annette Cannon, is doing a tremendous job going around to all kinds of organizations and talking about the deaths that are happening in our county and why. And with her background, being a registered nurse and having her PhD, she is a phenomenal speaker when it comes to fentanyl and the drugs that she is seeing that are taking the lives of the people in Jefferson County. And she keeps up on all of the statistics, not only those that come through her office. But I will go ahead and throw this back over to Dr. Story in reference to the Narcan and how you can get a hold of that.
Thank you. This. Thank you for your question. And this, just hits close to home. I have 3 teenage kids, and we have these conversations. What do you do if you see someone who's in trouble, who's having an overdose? And one of the services we provide at the Public Health Department, which is free of charge, you can come in to the health department and get Narcan, even if you personally, you don't have anyone close to you who's battling substance use disorder. Just like you said, you never know when you'll need it. My kids carry Narcan in their backpacks, as do many of their friends. And, it is something that we believe in. In a perfect world, I could prevent every single person from ever becoming addicted. But until that day, we need to make sure that we're keeping people from dying when we can. We also give out fentanyl test strips, which can test drugs for the presence of laced fentanyl as well as xylazine. And so you can actually come into the health department. There are certain hours where we do handout, and it is a service called Points West, which is not just for substance users, but is for everybody who cares about the problem. They are open at our 645 Parfit Street building, 10 to 5, Monday, Wednesday, and Friday. I was looking to my colleague as I was saying that just to make sure. But you can always give them a call. Their number's online at pointswestjeffco.com, and that lists all the services that they offer. And I'm very, very proud of that work.
And Sandra, I'll share one quick footnote. One of the things that the Gateway to the Rockies Opioid Council is working on is how we best leverage the settlement dollars from litigation regarding the opioid epidemic. And you may have heard me mention 5 priority areas. One of those priority areas is harm reduction. In fact, looking at some of the very strategies and how do we ensure that we can leverage the opioid settlement dollar to help us address some of the issues that you heard our sheriff and Dr. Story talk about as well.
All right, thank you, Sheriff and Commissioner. Let's go to Allison next. And I'll do, before Allison, you start, just one quick reminder. We still have time to get you in the queue if you press *3 now. So *3 to ask the commissioners, the sheriff, or all sorts of county staff that are standing by are available to answer your questions. *3. Allison, go ahead.
Yes, I wanted to ask kind of about permanent supportive housing and safe parking in relation to like mental health, substance abuse, and whatnot. I'm not sure what Lakewood and or the Jeffco Health, if they're working together to help create some permanent supportive housing that has the supportive services that go along with some housing options, and I just wanted to hear more about what Lakewood in particular is doing about that.
Allison, this is Jeffco Commissioner Lesley Dahlkemper. Thank you so much for your question. Interestingly enough, County Commissioners met with Mary Berg, who heads Human Services, and Kat Douglas, who also leads housing for the county, earlier this week, and we talked about the very issue of homelessness and housing, both challenges here in Jefferson County, but we work very closely with our local municipalities. One of the areas that we're focused on, for example, you asked about Lakewood specifically, is a partnership with the city that would focus on developing what we call a navigation center. And Lakewood was awarded $9 million from the state to help get the navigation center up and running. We are also looking at supporting the navigation center with some additional federal dollars from ARPA or the American Rescue Plan. You may be wondering, well, that's great, but what is a navigation center? One of the things that the navigation center would offer is emergency sheltering, also transitional housing, and affordable housing. And what's so powerful about this approach is that it has lots of wraparound services to help with everything from employment to substance use issues, mental health supports, and so much more. Let me take a moment to turn it over to our Human Services Director, Mary Berg, to share a little bit more about the work that we're doing to address homelessness in partnership with cities, nonprofits, and others. Mary?
Thank you, Commissioner Dahlkemper, and thank you, Allison, for your question and your interest in housing in Jefferson County. The Human Services Department is the home to our community development program in Jefferson County, and that program partners with different agencies, for instance, Foothills Housing Authority, Jefferson Center, nonprofits like Family Tree, to identify and dedicate some of the federal funds from this program that go towards both affordable and permanent supportive housing. And so we're very involved in partnering with the municipalities, as Commissioner Dahlkemper said, and our community development program is very active in the development for both affordable and permanent supportive housing. They're currently working with Family Tree on a site in Arvada for permanent supportive housing, so we're very excited about the new developments that are happening in our community. Thank you so much for your question.
All right, let's hear from Jana next. Go ahead.
Hi, thanks for taking my question. And I utilize the bike paths around towns in Jefferson County, and some places have individuals that are either homeless or utilizing drugs on the path itself. And my question is, who would I contact, or what's the best approach with something like that? Thank you.
Hi, Jana. Again, this is Sheriff Marinelli, and thank you for that question. Whenever you run across somebody that is in the process of using drugs, or even if you think that they might be under the influence, you can certainly call 911 and we will respond. So, again, we are dealing with a lot of addiction issues in the county, and the Sheriff's Department is used to handling those situations. We have our deputies are trained in crisis intervention, and so they can certainly get involved. And then I also know that they have some what we call street teams that come out from the health department that can also help these citizens that are using on the bike paths. We realize that is an issue. We deal with it as much as we can, but we do appreciate when citizens see it that they call us. That way we can come in and help these people deal with whatever it is that their needs are at that current time while they're using.
All right, thank you very much. Let's go next to Karen. Karen, go ahead.
Hi, yes. I live in Jefferson County, but I have a son in Denver area, and I'm sure it flows over to the other suburbs and counties of Denver area. But he had his vehicle broken into and taken for a joyride twice. Nothing was ever done. he had his motorcycle stolen at work. Thankfully, his boss saw it and chased the guys and got it back. I'm just wondering, you say it's lessened. I mean, he finally sold the vehicle because he said, this is ridiculous. I can't even keep a vehicle in my driveway. But I'm just wondering, how and are you addressing vehicle stealing? And I know of other people that have had it happen too.
Hi, Karen. Yeah, it's happening. We have been collaborating with all the different jurisdictions. Unfortunately, I cannot answer for Denver, and I cannot even tell you what their data is. I can only tell you what Jefferson County's is, and ours has gone down. I do believe from just watching the media that the entire metro area has started trailing downwards on those statistics. So some of the collaboration that is going on is working. But I can tell you that in law enforcement, we don't work within a silo. We actually have meetings with Denver, and in Jefferson County, we deal with State Patrol. We deal with our City of Arvada, City of Lakewood, City of every single municipality that we can. And we try to catch some of these particular crimes that can travel across jurisdictions. We work together to try to solve those problems and those issues. It's unfortunate this has happened to your son a few times, but we do, that's again, like I had said earlier, that's why we really stress with our citizens how important it is to take your personal property and make sure that you secure it to the best as you can, because a lot of the bad guys are looking for opportunities. And so we really can't stress that enough to take that opportunity away from them. So thank you for your question, and I hope that gives you a little bit of an indication as to where we're going with that. We have put in some tools of our trade to help us with capturing these people that are stealing vehicles, and it's working quite well, which is why our numbers are going down. We are not the only agency using them. Denver actually began, and so did Aurora, and everybody west of Denver started copying that so that, again, we can work in collaboration together.
Thank you, Sheriff. Let's hear from David next. Go ahead. Hello, David. You are live with our audience.
This might help the mental health for senior citizens. I was just wondering what the commission can be doing to help us with the Homestead Act, trying to get that improved for the upcoming property tax increases that we're going to be seeing. We could use all the help we could get, but maybe get that increase for the senior citizens. And I'd like to hear your take on it.
Yeah, great. Thank you, David. And I know you've been hanging on a while, so thanks for hanging on and for that question. And actually, some of the answer to that were some things that were happening today. So first of all, the county itself doesn't, that's not a policy passed at the county level. That was actually, that's a state policy, and so it's statewide, and so the state legislature are the ones who can deal with that, or a statewide ballot issue. And in fact, you may have seen that Governor Polis had a press conference today where he was talking about a special session. He is going to call the legislature back into a special session specifically to deal with property taxes and a few other things. Now, you might have known that the expansion of the Homestead Act was on the ballot with HH, which did not pass. Governor Polis was asked about the Homestead Act, and that will not be part of the special session, but he did express, and I have heard this expressed by some other legislators, that they would like to look at expanding it coming up in the next regular session, which does begin in January. So I know that that's something that is often looked at, expanding it, to folks beyond the kind of limited number of seniors who qualify for it at this time.
All right, thank you, Commissioner. We have just a couple minutes left. Commissioner Kerr, would you like to kick us off with some closing remarks tonight?
Absolutely. Thank you, Roger. And thank you, everyone, for participating in tonight's telephone town hall. And your input is critical, so we always encourage you to participate in the discussion whenever possible. And also would like to mention that a recording of tonight's town hall, along with the questions and answers from the discussion, will be posted to our town hall site. In addition, if you would like more information about tonight's conversation and the topics discussed, please visit our website at www.jeffco.us/townhall.
Great. Thanks so much, Commissioner Kerr. And we want to thank all of you for taking time tonight to join us, to ask questions, and to participate in tonight's town hall. Also, I'd like to take a moment to remind you that if we didn't get to your question or comment, please leave us a voicemail. At the end of our call tonight, you will hear a recorded message. Then you can leave your comment or question after the tone, and someone from our team will get right back to you. Thanks again for joining us tonight.
All right, thank you, Commissioners, and thank you, Sheriff Marinelli. Again, if you have thought of something that you'd like to ask or would like to make a comment, just stay on the line and wait for the tone. And as Commissioner Kerr mentioned, there will be a recording of tonight's conversation, both in English and Spanish, posted on the website www.jeffco.us/townhall. Thank you for joining us tonight. Stay safe and stay healthy, and just have a great evening. Bye-bye.